Welcome to Our Daily Health, Gestational Diabetes, 11 Natural Remedies for Gestational Diabetes. Gestational diabetes is a condition that occurs during pregnancy. In 2019, 16% of live births had glycemia in pregnancy, and 84% were due to this type of diabetes. This condition occurs in the third trimester of pregnancy, but its management is similar to other forms of diabetes. It is a common problem where blood glucose is high. Did you take a glucose test and failed, and you're wondering what to do? Worry not, because this condition is manageable. And in this video, you'll learn about 11 natural ways to manage diabetes in pregnancy. But first, what are the symptoms and signs of diabetes in pregnancy? Most women don't experience any symptoms, so it's difficult to tell unless they're tested, and most of the symptoms are common pregnancy symptoms, and you can easily ignore them. But since you know your body best, you can feel when something is off. Seek further treatment if you experience these symptoms: extreme fatigue, excessive thirst, frequent urination, frequent skin, bladder, or vaginal infections, blurred vision, extreme nausea. Gestational diabetes, 11 natural remedies for gestational diabetes. Number 1, schedule your diet. One of the primary causes of all types of diabetes is an irregular diet schedule. It teaches your body to expect massive influxes of calories and sugars accompanied by long periods of no nutrients. This habit alters your body's metabolic activity and negatively affects the functioning of your insulin receptors. A perfect way of treating or preventing diabetes in pregnancy is to stick to a strict nutritional intake. The American Diabetes Association recommends taking small meals every 2 hours so that your body adapts to processing and absorbing nutrients regularly. In turn, it'll prevent the fluctuation of blood sugars that characterize diabetes. Number 2, exercise often. Similar to other forms of diabetes, exercise helps prevent unhealthy weight gain. Naturally, weight is expected during pregnancy, but it can be managed healthily. For example, if you take 30 minutes of exercise twice daily, it will speed up your heart rate, stimulate your metabolism, and prevent the development of gestational diabetes. Strenuous exercises aren't advisable during pregnancy, but stationary activities and swimming, walking, or any light cardiovascular exercise will minimize your risk of developing this type of diabetes. Number 3, take a high-fiber diet. Another standard recommendation for the treatment and management of diabetes is consuming more fiber. Fiber stimulates the activity of your insulin receptors while inhibiting the release of excessive amounts of insulin into the bloodstream. As a result, it balances the level of insulin and prevents the onset of diabetes. Fiber should be a mainstay in your pregnancy diet because of its digestive and cardiovascular effects, but its relation to insulin receptors makes it vital. Flax seeds, nuts, oranges, melons, pears, berries, and vegetables, carrots, broccoli, and sweet corn are examples of fiber-rich foods. If you add them to your daily diet, you'll lower your risk of developing diabetes in pregnancy. Number 4, consume more vitamin D. Although vitamin D doesn't get attention like others, it is essential for numerous processes in your body. Some of its functions include absorbing critical nutrients and vitamins, including phosphate, calcium, iron, and magnesium. By maximizing the absorption of these nutrients, your vitamin D-rich foods, such as mushrooms, salmon, or tofu, you're guaranteed that your nutrient intake is adequate and constant during the day. Moreover, vitamin D boosts the growth of beneficial bacteria in the gut, which are crucial for a healthy pregnancy, according to the diabetic medicine research. Number 5, increase your vitamin C intake. Unlike vitamin D, vitamin C has a lot of attention from medical experts and the public. However, it doesn't mean that pregnant women consume enough of it as they should. Vitamin C deficiency is linked with diabetes in pregnancy. Research indicates that diabetic pregnant women who consume more vitamin C were less likely to experience severe symptoms. Furthermore, they had minimal chances of developing type 2 diabetes in the future. If you are enjoying this video, then please like, comment, share, and subscribe to Our Daily Health. Number 6. Astragalus. Research about herbal remedies for this form of diabetes is ongoing, but astragalus has portrayed the most potent effects. Research indicates that women who take astragalus as their folk treatment for diabetes show better blood sugar control and milder symptoms. However, since herbs can have complicated side effects, it is crucial to consult a medical professional before incorporating any herbs into your diet, especially during the delicate stages of pregnancy. Number 7. How about meeting your body's protein needs? One of the crucial roles of protein in your body is to break down carbs into more useful and manageable molecules. So if you're following the recommendation of consuming small meals per day, also try to pair carbs with protein. Doing so will regulate your metabolism to utilize the necessary amounts of insulin and ease the digestive process. What's more, protein is also vital for growth and development, which is crucial when you're growing a small person inside of you. Number 8. Boost your magnesium levels. According to the National Health Research Institute, pregnant women with diabetes were given 250 milligrams of magnesium every day for 6 weeks. Magnesium improved blood sugar levels significantly and decreased cell damage and markers of inflammation. Moreover, their babies experienced 20.6% low levels of bilirubin, a chemical that causes jaundice. It's best always to include magnesium-rich foods in your diet. Foods rich in magnesium include spinach, unskinned potatoes, tamarind, okra, fish like Chinook salmon, and Atlantic mackerel. Number 9. Have some adequate sleep. Adequate sleep is one of the perfect yet easiest ways of treating diabetes in pregnancy. The American Pregnancy Association suggests that you'll always find yourself exhausted during pregnancy because of hormonal changes. Therefore, strive to have an adequate sleep to balance your blood sugar levels. Also, sleeping on your left will release the tension on your backside and enhance blood circulation to your baby. One more thing, take short naps throughout the day to manage your condition. Number 10. Take a sugar-free diet. Diabetes is associated with sugary foods and obesity, as it relates directly to insulin receptors. So, one surefire way to prevent it is to remove sugar from your diet. There are many substitutes for sugar, including stevia and agave nectar. Both are natural sweeteners. With more complex sugars your body needs than simple sugars, exacerbate your symptoms. Besides sugar, carbohydrates may also spike your blood sugars, and you should cut them from your diet. Adopt a low-carb diet that's rich in fats and proteins to keep your blood sugars in check. Number 11. Maintain a healthy weight. Finally, try maintaining a healthy weight. Consult your healthcare provider about your weight gain during pregnancy. All women of average weight should gain around 11 to 12 kilograms during pregnancy. If you gain more than this, you're at a higher risk of getting diabetes. Eat a balanced diet, drink lots of water, and exercise regularly to maintain a healthy weight. Bottom line, your child's health will always be your priority, and your choices while pregnant affect your child. Cutting down on carbs and sugars, exercising regularly, and increasing your vitamin C and D intake will help you prevent or manage gestational diabetes. However, don't ignore symptoms regardless of how mild they are. It's best to consult your doctor. Which of these natural remedies for gestational diabetes do you like best? Comment your answer below. If you like this video, give it a thumbs up and share it with your friends. For more health and wellness topics, please subscribe to Our Daily Health.